Some think that COVID can reactivate Lyme or Bartonella. How can a patient tell if their ongoing symptoms after COVID are long COVID or reactivated tick-borne illnesses? And should they proceed if it's hard to differentiate?
Well, that's the $64 million question. A lot of people are fooled into thinking they have long COVID. So they present to my office and say, hey, I had COVID, a year ago, and I think I got long haulers, long COVID. And lo and behold, they're tested. They were oblivious to the fact that they had Lyme disease. So we discover that for them. And then it's kind of like, well, what is it? Is it the COVID coronavirus spike protein doing this? And if their spike antibody titers are, greater than 25,000, and get the quantitative, not the qualitative, like, yes, there's spike or no, there isn't. You need a quantitative, because the higher that spike antibody titer is, more likely the more spiked they are. And so it could be a combination of, it could be solely spike, it could be solely Lyme, it could be a combination of both. We're seeing that combo. It could be other things like mold toxicity, mold illness, leaky gut, heavy metals, environmental agents that are toxic, the foods we eat, the environments we're in, the mixed witch's brew of chemicals, forever chemicals that we're exposed to constantly can all play a part. So it becomes sort of a point of, well, you can spend a lot of money using biomarkers that might be questionable in narrowing down the diagnosis, or you can start treating and maybe challenging patients with certain treatments to see if they're effective, and get into this mindset of learning to live with these organisms than sort of what's been since the germ theory, just obliterate them, just blast them out of your body. And then you have all this collateral damage that can occur in the gut, things like that. So, you want to make sure that your detoxification pathways are open. You want to make sure that your gut microbiome is optimized before you really start any kind of treatments. And sometimes in my practice, it's a moot point about, well, should we split hairs and should we spend, $2,000 trying to figure out if it's Lyme or COVID, instead of just like treating the patient with what we know will possibly work and cover both conditions.